Good morning. So good morning, ladies and gentlemen. I would like to welcome you to the second plenary session of this conference, which will focus on making dementia a priority. Together with the rest of the organizing committee, I would like to thank the speakers who accepted to participate in this session and share with us their thoughts on this topic, which I'm pretty sure that you will find very interesting. I would also like to extend my warm welcome to individuals living with dementia who have also joined us. With regards to presenting myself, I am Charles Scerri, chairperson of the Malta Dementia Society and former vice chairperson of Alzheimer Europe. I currently hold a full professorial position at the Faculty of Medicine and Surgery at the University of Malta, with special focus on neuropharmacology and dementia studies. As national focal point on dementia, I authored the first Malta Dementia Strategy, which was published and launched in 2015. Going back to the title of this session, there is no doubt that dementia is one of the most important and greatest scientific, medical, and socio-economic challenges that we are facing worldwide. Although a lot of countries have recognized dementia as a social and healthcare priority and have developed national dementia strategy, we all agree that a lot of work still needs to be done. We will have 4 distinguished speakers who will discuss this topic during this session. I would appreciate if you switched off your mobile phones or set them on silent mode. Time permitting, we will take 1 or maybe 2 questions after each presentation, and at the very end, I will be inviting the speakers to join me here on the podium to continue exploring this topic. So our next speaker is Katrin Seeher from the World Health Organization. Originally trained as a psychologist, Katrin has been working with people with neurological disorders, such as dementia and their families, for almost 20 years. In her current role at the WHO Brain Health Unit, Katrin is responsible for the implementation of the Global Action Plan on the Public Health Response to Dementia from 2017 till 2025, and leads the unit work on brain health measurement across the life course. Katrin will be talking about key achievements of the Global Action Plan on Dementia.
Thank you, Charles. Good morning. Welcome back to day 2. It's a pleasure seeing so many of you in Geneva. It was very easy for me just coming down the hill from WHO. Okay. I'll take you now from a national level to the global level when it comes to formulating dementia policies or comprehensive dementia strategies. With the action plan coming to an end, potentially next year, it's an opportune time for us to take stock, see what have we achieved in the last 7 or almost 8 years, and what still remains to be done. So with the adoption of the Global Dementia Action Plan in 2017, the member states committed to a global vision of a world in which we can ultimately prevent dementia, and people who live with dementia and their carers live well and receive the care and support that they really need in order to fulfill their potential and live with dignity, respect, and autonomy. But the more short-term goals really were to improve the lives of people living with dementia and their carers, while at the same time trying to decrease the negative impact that dementia can have on the individual as well as on societies. So that was really the vision, and the goals are the overarching principles and our guiding vision. But they're very ambitious. The action plan did that by postulating or introducing 7 strategic action areas, which you see here on this slide. And they really touch upon the broad spectrum from policy making or making dementia a national priority at government level, all the way to awareness and inclusion, risk reduction, providing better diagnosis, treatment, and care, as well as support for family members and carers, but also strengthening the health information system so that you can better report on what is happening in the area of dementia in national but also international level, and strengthening research and innovation. And then the action plan outlined global targets for each of these 7 action areas, and I'll walk you through my presentation on where we currently stand with reaching those global targets. But there were also actions for member states with recommendations on what you could do at the policy level or at the system strengthening level to improve care for people with dementia. And there were also actions for other partners, other stakeholders, and WHO. We're using what's called the Global Dementia Observatory, which is really an indicator framework to monitor progress towards reaching those targets and implementation of those actions. And compared to the last time we did this data collection with WHO member states, this time around 78 member states participated. They submitted their data. We're still following up on a few regions, but the good news already is that we're with those countries, we're capturing already about 61% of the global population that's 60 and above. So trying to make sure the information is representative. And the other positive thing, I think, is that in this time, more low and middle income countries submitted or participated in the data collection. So we now have a much better idea of what is happening around the globe, especially in low and middle income countries. But the more interesting thing for you is probably to see where are we in terms of reaching the global targets. And this is depicted here on this slide. So ideally, we would have been in next year, in 2025, for each of the action areas where on the bars kind of like indicate those black lines. Instead, you see in green and red the countries or the proportions of countries that have reported to WHO so far. And the green are the countries that are meeting the target or contributing to the target, and the red ones are the ones that don't. So I'll quickly walk you through the different targets. The first one is having a dementia plan, a national policy, either standalone or integrated. You see at the moment, and these are 50 countries, but we would need to get to 115. So far off from reaching the global target. For action area 2, about awareness raising and increasing inclusion and dementia friendliness, we have 2 indicators. And again, you see that there is some positive movement and development, but we're not meeting the targets yet. And the story goes on in a way, but I don't want to sound too depressing. But we still have a lot to do when it comes to risk reduction. Globally, the prevalence of risk factors, and particularly risk factors that also are linked to NCDs, they're not improving as fast as they should. We're not reaching the diagnostic rate, which was set to at least 50% diagnostic rate in half the member states. We're still providing too little carer support, given that carers provide the bulk of home care and support to people living with dementia. Reporting ability of countries has slightly increased, also due to the Global Dementia Observatory, but again, we need more countries to come on board. And the last one on research was, the call was for doubling dementia research output. And you see, compared to other conditions that cause a lot of burden, dementia actually has increased output, roughly about 33%, but again, we have to do better in order to reach the global targets. Now, I said I don't want to sound too depressing, because when you just look at the global targets, you might think, yeah, okay, so what? What has happened over the last seven years? So over the next few slides, I want to take you through some of the key achievements, and I'm focusing more on things that WHO has control or some involvement in, and that is not to say that all the important achievement, the research advances, the breakthroughs in science that have happened, and the work that communities are doing in providing better care and support. They are not reflected on these slides probably, but they haven't gone unnoticed. But talking to some of the key areas that WHO is responsible for, one is providing technical tools, or norms and standards, as we say, to member states that are ready to implement, adapt by countries. And you see on the slide, so for every action area, there is now at least one tool available to strengthen or implement the actions that are outlined in the action plan. So we have a policy guide to develop dementia plan. We have a toolkit for dementia-friendly initiatives. We have risk reduction guidelines that are currently being updated. There are treatment guidelines for dementia, but also for integrated care for older adults, and a package of rehabilitation that includes a dementia module with just rehab interventions for dementia. We have iSupport as a caregiver training, which I'll come back to. The Global Dementia Observatory for enhancing monitoring, I've already mentioned. And in the area of fostering research and innovation, there is now a blueprint for dementia research outlining key priority areas and milestones. As well, later this month, we'll release preferred product characteristics for blood test for Alzheimer's disease. So lots of tools are available. What do we normally do with tools? That brings me to the second key area of responsibility that we have, and that is capacity building. So since the adoption of the action plan, we've run together with partners 16 regional workshops that included almost 90 countries worldwide. And what do those workshops do? They offer the opportunity for policymakers, civil society, clinicians, and people living with dementia or their carers to come together. And sometimes in some regions, that's really for the first time, coming together and discussing, learning, exchanging experiences, and discussing ways in which the meaningful, the most important actions could be adopted for countries. And I've given you some photos here just of the workshops that have happened. Some were due to COVID, of course, done or delivered virtually. Another thing is bringing people together, and again, that's a segue from the workshops. So I've mentioned all the technical tools that we have, but without implementing those tools and without creating the capacity or fostering the capacity to do that, they just sit on shelves. And here, I think one really big achievement or success has been the creation of this international eye support network. So eye support is our carer training. It's available in different formats as a PDF manual, as an online training, as easy read quick posters, a short video, and also as an mHealth intervention. But the really nice thing is now we have this network members meet once a month. They cover over 40 countries and almost all the languages in which eye support is available or is being translated into, and really try to bring carer intervention and carer support to more people globally. If you want to find out more about eyesupportfordementia.org is the URL. And again, direct segue from building networks is also sharing knowledge. How do we support implementation and making that process from creating new tools, new evidence, releasing research, to integrating it into practice or in policy? So we have the Global Dementia Observatory Knowledge Exchange Platform, which is a website, our repository of good practice resources. Those resources have all been vetted. They've been peer-reviewed by an amazing network of over 100 experts. We have focus groups of people living with dementia, again, covering many areas or countries of the world that meet monthly or twice a month to review resources that are being submitted to the platform to ensure that they really, if they were implemented in other countries, have a lasting impact and really change the lives of people living with dementia. We created that knowledge sharing platform specifically for policymakers. So as they go through the GDO data collection and they identify where there might be gaps in their national dementia responses, they have this platform to go to find inspiration of what other countries are doing, what's available, and we're hoping that this way the implementation process can be sped up. And now you might be asking, okay, 2025 is just around the corner, so what's next? What will happen to the Global Action Plan? Especially because I showed you that the global targets won't be met. I think it's important to build on what we have achieved so far. And again, I don't mean just the few success stories that I shared this morning, but also on the successes, on the achievements of all of you here in the room and the other, the broader dementia community. We now also have new or extended WHA mandates for neurology, for mental health, for NCDs. These all are kind of extended and ongoing commitments that we can draw on, and that also help us strengthen or increase national dementia responses. And we've also had other high-level declarations at the G7, G20. I think they're just meeting this week in Italy, or the Dutch high-level meeting last year. So they're all sending signals, and we need to accelerate action. We need to continue our efforts. Because we still share our vision of a world in which we can prevent dementia and ensure that people live well. So as a result, member states will discuss the potential extension of the Global Action Plan at the Executive Board meeting next February, and then make a recommendation for the World Health Assembly in May. So hopefully in May, we'll have a decision from member states. With that, I hope that you found this overview interesting. If you want to find out more or access any of the resources, scan the QR code or visit our Dementia Health Topic page. Thank you very much.
Thank you very much, and thanks WHO as well for the great work that they are doing. Maybe we have time for a question. Any questions from the floor? We have a question there.
Yes, hello, my name is Lieselotte Klotz. I'm from the European Working Group People with Dementia. And I have a question. Now we are ready in Germany to build up a group of people with dementia to work together with WHO. And what is the type of support you can give us? Because our goal is to push our national dementia strategy in Germany in a way we want to help the specialists and the governments with our knowledge about dementia, living with dementia, and we want to advocate them. And how can we do it?
That's a bit of a tricky question, but I'm really glad to hear that you've made progress on, getting your group together. And I know we should also continue our conversation about how your German network can inform the decisions that we make at WHO. I think the important part is having in the policy implementation, having a role. And my understanding is that you're in the implementation part already, you have a place, you had to have a seat at the table. It's then just a matter of making good use of that, and we can exchange on ways or what worked also in other countries. But well done on all the work that you're doing, Lilo.
So thank you very much. Let's pass on to the next speaker, who is from Malta. He's Alex Gobey. Alex is currently the director of the Dementia Care Directorate within the Active Aging and Community Care, and coordinates specialized services in community-based and residential settings in Malta. He has previously worked as a speech-language pathologist and has extensive experience in the rehabilitation and communication and swallowing disorders. He is also a lecturer at the University of Malta. Alex recently chaired the Dementia Strategy Advisory Group that designed Malta's second national dementia strategy that runs from 2024 till 2031. And in fact, he will be speaking about the Maltese second national dementia strategy. So, Alex, please.
Thank you, Charles. I will just load the presentation. First of all, I would like to congratulate Alzheimer's Europe for this amazing conference, John George and all the team. You're doing a fabulous job. It is my absolute pleasure to be here today to use the following 15 minutes to give an overview of Malta's journey towards our second national dementia strategy on dementia. I'll be sharing with you processes that we've gone through as a country with the hope of helping other countries who are currently going through similar processes to form their national strategies and plans. First of all, I'd like to give you some context. Malta is the smallest country in the EU with a population of 514,000 residents, being one of the densest population countries in the EU. We also have one of the highest life expectancy in Europe. So when you look at our population, it's no surprise that our population is aging. And in fact, we are exhibiting the inverted pyramid due to low birth rate and a high life expectancy. And when you look at our foreign population, which amounts to 20% of the overall population, these are forming the backbone of our care and economy. It is thanks to this foreign population that we are coping with our high old age dependency ratio. The foreign workforce is currently compensating for a lack of local workforce. And we are very thankful for all these individuals and the good work they're doing in our residential care settings, acute settings, etc. Without their help, our hospital systems, our healthcare system can potentially be in trouble. So it is no surprise that when we look at our data with regards to people living with dementia, these are on the increase as well, and they are expected to increase to 3.31% of the population by 2050. And this is no joke, it is a concern. And the study by Scerri was in fact a huge driving force with regards to our first dementia study back in 2015. This obviously is going to create a lot of stress, a lot of impact on family members, family carers, but also our support systems, our hospitals, and our community services. So by now, you're probably thinking this guy likes graphs a lot. This is the 5th graph I'm showing you. And in fact, I do like graphs, I do like statistics. And guess what? Policymakers like graphs as well. They are a good way to show the facts, to show the statistics, and they're especially important when it comes to those meetings with policymakers when you have 2 minutes, 5 minutes to make a point and make a case for your strategy. So it's important to offer quick information presented in a clear way, which is understandable in a glance, to make the case for your policies. So use statistics, visualize them in an attractive way, in an easy-to-read manner, to get your policymakers on board. But it's not the only thing that needs to be done. There are other things that have to be done to convince your policymakers. Awareness is crucial, and over the years in Malta, awareness was built slowly through public awareness campaigns, which used various media, the traditional media system, social media, but also we had opportunities to carry out open theater, for example, in our local areas, which was effective to depict to the local population what a family with dementia goes through during their time dealing with the condition. So by making dementia a public issue, then it will become an issue also to the policymakers. And in fact, the most effective advocacy takes place when it comes from the persons living with dementia and their caregivers. And I think we can all agree that yesterday's plenary panel by the European Working Group of People with Dementia did an amazing job. And this is what it's all about, and I think this is why we're all here today. So I'm very glad that recently, even in Malta, people with dementia are coming forward and making their voices heard. And I'm very glad that the Malta Dementia Society is currently carrying out working groups for people with dementia, and these are meeting regularly with the hope of getting more people on board, making their voice heard, and having an impact on policymakers as well. Collaboration is another aspect, another crucial element when it comes to policymaking. Collaborating with NGOs, with civil society, and creating one strong voice towards our difficulties, towards our problems. And it all starts from a proposal. It all starts by highlighting the gaps in a clear and well-researched manner, using the local data that you have, and modeling also successful policies carried out in other countries and regions. We have a number of countries here who have been through a number of policies, a number of experiences, and it's important to get that knowledge and apply it to your situation. And it is important as well to leverage the latest data being provided by international organizations, such as the Global Action Plan by the WHO, reports by ADI, and reports also by Alzheimer's Europe. These will give your policy an international backing to solidify your arguments. Another important factor is the economic factor. It's important to highlight the cost of inaction. If we do not create a policy, if we do not create a strategy, what are the economic costs of that? And also, it's important to highlight the effects of an effective policy and how proactively this can save money in the long run. for example, by reducing hospital admissions in our acute hospitals. Every country needs to identify their national policymakers, and when you have that meeting, it's important to go for that meeting with a clear proposal with actionable solutions. You cannot go for this meeting with the issue, with dementia as a concern, with the data only, but you have to go with clear, actionable solutions. And you might need to work on some misconceptions which policymakers might have on the condition and make some breakthroughs in that as well. So now I would like to briefly go through our story with regards to dementia policy. In 2015, as Charles mentioned, we launched our first national policy entitled Empowering Change, which basically laid down the foundation and the building blocks for a number of essential services which are currently running in Malta. In 2023, a review of the recommendations which were implemented was carried out, and a number of gaps were also identified and integrated within the new proposal. This leads us to the new strategy now entitled Reaching New Heights, which essentially builds on the solid foundation laid down by the first strategy. A proposal was drafted, approval was granted by the ministry, and the strategy support group was created. The group was made up of representatives of different stakeholders, professionals working in the field, NGOs, family caregivers, and the person living with dementia. The input from the person living with dementia was invaluable, and it enabled us to create a more person-centered and a more humanist plan. We then moved on to the public consultation phase, where for a number of months we received feedback from individuals, entities, services, and discussions were held with these people. We changed the strategy accordingly, and in February, 21st of February of this year, we launched the proposal that was approved by the cabinet. So the strategy is available online. I'll be linking it at the end of the presentation. Briefly now I'm going to go through the key action areas of the strategy. The first key action area is creating awareness and understanding of dementia. This is, I think, essential in all strategies. You can never create enough awareness, and this needs to be continuously updated as new data comes around. A new key action area is risk reduction. We know that there are modifiable risk factors which can be used to reduce the prevalence of dementia, possibly. Timely diagnosis. We still have a lot of work to do in Malta to increase diagnosis rates and diagnose people earlier. Living well with dementia, consider implementation of pharmacological and non-pharmacological treatments when it comes to dementia care to help caregivers and people living with dementia. Educating our workforce is crucial, especially because, as I mentioned before, 20% of our workforce are foreign workers, so there are challenges with regards to dementia care, but also with regards to language, communication, and cultural differences. Also, the management of dementia itself. We need to aim for more seamless transitions from one service to another, a more integrated approach across our services. The seventh key action area is research and information systems. We need to work more, to invest more in research, local research, to improve services and create new services based on local evidence available. The strategy also focuses on a number of specific groups in our community, such as people with early onset dementia, people with learning difficulties and dementia, LGBTIQ+ persons living with dementia, and migrants living with the condition as well. These people are a part of our community, and we need to cater for their specific needs. We are now in the implementation phase, started working on a number of objectives and initiatives, and in the coming weeks we will be creating an implementation committee to continue working on the strategy's now implementation. I'd like to finish off my presentation with some inspiration. I'm using this wonderful photo. I think the Maltese delegates, I think, identified the person there on the photo. That person is Neil Ajus. He's an ultra-endurance athlete, swimmer, and recently in Malta, he swam for 142 kilometers in an open sea conditions for 60 hours and 35 minutes. And this is a world record swim, which he completed with great determination, preparation, and strategy. Neil had a whole team of doctors, nutritionists, family members supporting him along the way, so he wasn't alone. But he encountered a lot of difficulties. He had hallucinations during the swim. He suffered from hypothermia. But he completed the challenge and inspired a nation and inspired us all to perform at our best in whatever we do. So we all have the power to achieve great things in whatever area we are working in. Neil inspires us to be the best in what we do, and together we can make the impossible become possible, like he did in this challenge. So I thank you for your attention. That's the QR code leads to our strategy. Thank you.
Thank you very much. Well, what can you say about Neil Ajus? He's an icon, right? Swimming for 152 kilometers is definitely no joke. Do we have any questions, maybe a comment? I do have a small comment, actually, because I may seem a little bit biased here, but I am extremely proud coming from Malta. A very small country, doesn't even show on the map of Alzheimer Europe, even though I have been telling them for ages now, but it does not show. But I feel extremely proud in living in Malta, very tiny, small island, which was one of among the first, I have to say, countries to adopt and implement national dementia strategy, and now it is in its second one. So for a small country like ours, with such limited financial and human resources, to be able to make it in some way or another, it must be a good example for other countries to follow. But again, I am biased. So thank you very much, Alex, for that wonderful presentation. So our last speaker is Giovanni Frisoni from Switzerland. Here. Giovanni is a clinical neurologist and a full professor of clinical neurosciences at the University of Geneva in Switzerland, and director of the Memory Center, Geneva University Hospital. Formerly scientific director at the National Alzheimer Center Fate Bene Fratelli in Brescia, Italy. He leads a team of about 35 scientists and clinicians, and to date has authored over 750 scientific papers on the use of biomarkers for earlier and more accurate diagnosis and prognosis of Alzheimer's disease and other dementias. He has led national and international projects funded by important European and pan-European funding bodies, attracting over 35 million euro in competitive research funds. He acted as chairman of Alzheimer Imaging Consortium at the International Conference of Alzheimer's Disease in 2010 and 2011, and is an honorary member of the Austrian Neurological Society and the French Society of Neurology. He has received the Investigation Award winner of the European Academy of Neurology back in 2016. And Giovanni will be talking to us about from dementia to brain health, the example of the Swiss Brain Health Plan. So thanks, Giovanni.
Thank you, Charles. Good morning, everybody. Thank you, Charles, for this introduction, which tells you not so much about my achievements, but about my age, the longer you live, of course. Today, I will address the issue of brain health and what we're doing in Switzerland in this field, in this domain. Well, first of all, what is brain health? this is not a good start because there was supposed to be the definition of that you find in Wikipedia, which I will tell you orally. If you look in Wikipedia, you will find that brain health is a full state of well-being that allows the person to achieve the best, to make the most of their potential, which is a wonderful definition. It doesn't, it's not terribly practical. It's a very nice idea, but as always, moving from theory to practice can have challenges. Now, in Switzerland, we have operationalized. This is the old. I apologize, just a second. This is the old. C'est la version précédente des diapos. Vous devez avoir une nouvelle version. In Switzerland, the former chairman of the European Academy of Neurology, Claudio Bassetti, who is with whom many of you are familiar with, has spearheaded at the European level the concept of brain health and what we can do to improve brain health in Europe. And he has tried to implement these notions, these ideas at the Swiss level. In Switzerland, we have, Claudio has operationalized the concept of brain health in a number of aims and in a number of practical programs to carry out. The programs are on 4 pillars: on teaching, on research, on care, and on information. And they can be horizontal to all aspects of brain health. When we talk about brain health, we touch many of the typical aspects of the typical domains of medicine. We touch neurology, we touch psychiatry, we touch neuropsychiatry, child neuropsychiatry. And medicine is organized in silos. If you want to do something really effective for people, you have to hook on to what is already available in medicine. You have to work on the activities that medicine is already carrying on. And medicine is organized in silos, which we can criticize as much as you wish, but this is what we have. So the challenge is to implement activities that are horizontal to brain health as a unique concept, but to operationalize, to implement them using the silos that medicine is currently working on. Et voilà. This is the right presentation. And this is what I was talking about. Now, today, this is the notion of the silos of medicine, which is organized by diseases. Of course, today I will focus on cognitive disorders. This is why we're here. And I will touch on some of the horizontal activities. In terms of teaching, we will be launching, actually, starting in December this year, we will be launching the first international course on brain health. It's an online course, 15 credits. Feel free to spread the word. It's an opportunity to learn and to spread the concept. Research. We organized this year in Geneva the first conference on brain health services and the prevention of dementia. I don't have the time to go into the details of all these activities. Those of you who are interested can come to me afterwards. And in February 2026, we will hold the second conference where a number of mainly European experts will discuss the programs that are currently ongoing in Europe to promote, to prevent Alzheimer's disease and other dementias. At the level of information, in Geneva, we are now, we have this program of Atelier Mémoire, memory workshop, where we inform the community, citizens, on how to protect brain health with educational training, a number of sessions of educational training, with cognitive training, computerized cognitive training, a session on nutrition, and a session on physical exercise. But this is information. Okay? Cognitive training is practical. Everything else is information. And we plan to touch about a bit more than 1,000 people in the canton of Geneva, whose population is more or less the same as Malta. It's a start. This is the beginning of planting the seed in the community. Of course, the aim is to reach as many citizens as possible, but you have to start somewhere. And we have the funds and the energy to touch about 1,000 and something persons. And then let me move to care. And this is going to be this is going to take the largest part of this talk. Now, when we talk about brain health, the trap is that we're already doing brain health, right? In neurological departments, in psychiatry departments, we are promoting brain health. So if you go, you remember yesterday we had, the opening was given by the Ministry of Health of Geneva, Monsieur Pierre Maudet. And he was announcing this project that the state of Geneva will fund on brain health for citizens of Geneva. But what will he be funding? If you go to a politician proposing a program of brain health, the first question he is asking is, what's new versus what we're already doing? You're already taking money as a GP to do primary prevention. You should explain to your patients as a GP, you should explain how they should live, the lifestyles that we should have to protect the brain. You're already taking money for that. For patients with dementia, well, we are already funding memory clinics. So tertiary prevention to improve the quality of life of patients and give psychological support, use the drugs that we have available today, you're already taking money for that. So what are you asking money for? And the answer is, we're asking money for secondary prevention. What is a secondary prevention of dementia? this is something that it's a patient journey that we do not have in place nowhere in the world today. What is that? Well, secondary prevention, of course, is between primary and tertiary, obviously. Primary is what you do in the general population regardless of the risk, right? The information, the atelier mémoire, the memory workshops. We do not measure the risk of persons, of the citizens who are coming to us. We give this information to everyone. Tertiary prevention, you do that in memory clinics. We have patient journeys for persons who already have cognitive impairment. You have, what do I mean by that? Well, you have cognitive complaints. You tell your GP that your memory is not working. The GP sends you to the memory clinic. In the memory clinic, you undergo memory tests, okay, a battery of neuropsychological tests. If your memory tests are abnormal, the memory clinic has something to offer you. Drugs, psychological support, whatever. They have something to offer. They have a patient journey in place. But you may also come out normal on memory tests. You may have the feeling that your memory is no longer working as it used to, which is my case, for instance, and the case of many people of my age, but your memory tests are okay. For these persons, there is no patient journey. What do they tell you in memory clinics? They tell you everything's fine, go home, be happy. What we proposed to the Ministry of Health is to set up a patient journey for this type of persons. What does it consist of? Well, it's a patient journey that we have developed with a number of European experts, some of whom are in this room, and I wish to thank them all. Jean-Georges, I hope that the others will not take offense if I mention only the boss here. And it's a patient journey which is on 4 pillars. The 4 pillars of risk assessment, risk communication, personalized prevention, and cognitive enhancement. If it's for me, I'm busy now. Let me show you now how we operationalized, how we implemented all of these pillars in Geneva. For risk assessment, we developed an app where we collected all the known risk factors. What are the risk factors for dementia? You know them already. I know that all of you know about the Lancet Commission, but this is not only the Lancet Commission risk factors. In this slide, what you can see is that risk factors are categorized in 4 categories. This is not the way that you usually see risk factors. The 4 categories are, number 1, constitutional and non-modifiable. Age, genetics, education, and air pollution. Well, with air pollution, we can do something, but not in the short term. It's complicated. So let's assume these are basically, practically non-modifiable. Then there's risk factors which are modifiable, and they can improve your brain reserve. What's brain reserve? Well, it's the resilience of the brain if something bad happens. Stroke, plaques, trauma, whatever. It's the resilience, whatever you want to call it, of the brain. And there's a number of those: hearing loss, traumatic brain injury, alcohol consumption, depression, and social isolation. We know how to address these risk factors. If a person has one or more of those risk factors, you put in place individual actions on each of the risk factors. But then the most interesting thing, here comes the most interesting part. There's two more categories. There are the modifiable vascular risk factors, hypertension, obesity, smoking, physical inactivity, and diabetes, for which we have an intervention which has been shown to be working, to be effective. And then, and I will tell you later on, many of you already know what I'm referring to. And then the fourth category is modifiable risk factors for neurodegenerative diseases. What are they? Well, Alzheimer's pathology. I may have amyloid pathology in my brain. Some of you may have, I hope not, but probably some of the oldest ones may have some Alzheimer's, some amyloid, some tau. Some may already have some brain shrinkage, despite our neuropsychological tests are absolutely perfect. And this is a risk factor. Not all of those who have amyloid pathology in their brain will develop Alzheimer's. Far from it. 80% will never develop Alzheimer's, but 20%, 25, 30, depends, they will. So they are at high risk for Alzheimer's dementia. So with this app, we will collect all the risk factors from one person, but knowing the risk factors individually of a person is not sufficient. You also need to know the size of the risk factors, because the risk is everywhere. Risk is everywhere, right? So telling someone that he's at risk, everyone is at risk for something. Is it high risk? And if high, how high? And we can measure the risk. The risk of all of these risk factors can be measured. And we know it. The literature, studies have been done. So you detect which risk factor one person has, and based on the size of the risk, you can compute a number of risk, a size of the risk. Once you've done that, you have to communicate the person. You have to tell the person, well, your risk is 35%. What does it mean? If you tell me that I have cancer, I understand what it means. I'm not happy, but it's easy to understand. If you tell me that my risk is 35%, but what does it mean? So communicating the risk is not an easy task, even to someone who is mathematically literate. So we have developed my coworkers have developed an app which makes use of graphs to show how many persons without the risks develop dementia in the future, and how many with the risk develop dementia in the future. You translate the concept of risk, the mathematical concept of risk, into an image. And what this app also allows is to see how much of the risk is due to the vascular risk factors and how much is due to the degenerative risk factors. Why? Well, because the interventions are different. What are the interventions? Well, this is a slide which summarizes. These are the four categories that I have mentioned, and based you measure the risk for each of these, and if you find a high risk in each category, you go towards a specific risk reduction program. Of course, one person can have a low risk in all categories. Very well, fine. You go home, primary prevention, you do the healthy lifestyle, and that's all. Others may have other high risk in 1, 2, 3 categories, or 4, even the constitutional ones. In that case, they go into 1, 2, or 3 programs, risk reduction programs. Here are the risk reduction programs. the one I already mentioned, that those on brain reserve, well, you act on the individual risk factors. The program for those with high vascular risk will be the finger program by Mia Kivipelto. She has shown that this is effective, so what we should do is simply use it. It's a structured program leveraging on control of a cerebrovascular risk factor, Mediterranean diet. Well, you read it yourself. It's a structured program. It's not a lesson, okay? You have to attend a number of hours of physical exercise per week, not simply listen to a nice lecture of what you should do and maybe go home and sit on the couch, potato, and no. And we developed for those with high neurodegenerative risk, we developed what we call the Ginger intervention, which is Geneva finger, with a number of other interventions based on probiotics, supplements, nutritional supplements, multivitamin, and others that you can read. I don't have the time already. Have exhausted my time, by the way, and I can tell you more if you're interested. So this is the program that the Ministry of Health has funded in Geneva. We plan to involve 1,000 persons, citizens, in 4 years. We are well aware that this program, probably the major challenge of this program is, guess what? Money. What a surprise. Sustainability. Who's going to pay for it? And this is something we're going to address with specialists of the field, certainly not researchers, certainly not physicians. Don't ask them about sustainability. Deloitte Consulting, and we will develop a sustainability plan. What I have just illustrated to you is nothing new. I would like to tell you, this is rocket science. No one has ever done it before. No, it's not the case. This is exactly what the vascular field, vascular prevention, stroke prevention, myocardial infarction prevention has done in the past decades. In 1945, blood pressure was thought to be a consequence of aging, like amyloid today. It was not, and most likely also the risk factors, amyloid and others for Alzheimer's are not. And we hope that we in dementia, in Alzheimer's field, we will be as successful as the vascular field in the next decades. And I thank you for your attention, and I thank the people from my group who's been working on this program: Federica Ribaldi, Christian Kikerio, Christian Moreau, Augusto Mendes, and Ods Gesayen. Thank you all for your attention.